Okay, situated in the midline of the neck. It extends from the skull base to the esophagus. It's in front of the 6 cervical vertebra. Now this pharynx lies behind the nose, mouth, and larynx, and it is divided into the 3 parts. One is the nasopharynx, the second is the oropharynx, and third is the laryngopharynx or hypopharynx. The shape is an irregular fibromuscular tube lined by the mucous membrane, and the length of the pharynx is 15 centimeter. Now the histology, the pharyngeal wall is formed by the 4 layers. One is mucous membrane, which is lined by stratified squamous epithelium, except the nasopharynx. The nasopharynx is lined by pseudo-stratified epithelium with goblet cells. And second is the pharyngeal aponeurosis. This consists of loose connective tissue which contains lymphoid tissue that aggregates in some areas and forming tonsils or Waldeyer's ring. Third is the muscle layer. There are 3 muscles which form the pharynx, that is superior, middle, and inferior constrictor muscles. You can see this is the superior, middle, and inferior constrictor muscles. And fourth is a thin coat of connective tissue which is known as buccopharyngeal fossa. See the layers of the pharyngeal wall: mucosa, submucosa, pharyngobasilar fossa, muscular coat, buccopharyngeal fossa, and the pharyngeal plexus. What is Waldeyer's rings? Is the collection of the lymphoid tissue in the pharyngeal aponeurosis in some areas forming tonsil. So there is a presence of one nasopharyngeal tonsil, which is also known as adenoid. The 2 palatine tonsils, and third is the 2 lingual tonsils. And Waldeyer's rings also constitute the lymphoid follicles in the posterior pharyngeal wall. So these 3 plus lymphoid follicles in the posterior pharyngeal wall includes the Waldeyer's ring. See adenoid, palatine tonsil, lingual tonsil, and nodules in the posterior pharyngeal wall, and is the tubal tonsil. There is a lymphoid bands in the tubal tonsil, also in the Eustachian tube area also. Now the anatomical importance of this muscular coat is, as the muscular coat is formed by the 3 constrictor muscles, and in the lower inferior constrictor muscles there are 2 muscles. One is thyropharyngeus and cricopharyngeus. So in between these inferior thyropharyngeus and cricopharyngeus, there is a small gap which is known as Killian's dehiscence, which is the gateway of tears. And also this is important for forming the pharyngeal diverticulum. There are 2 spaces, retropharyngeal space and parapharyngeal space. The space which lies behind the pharynx is the retropharyngeal space, and the space which lies lateral to the pharynx is the parapharyngeal space. This is the parapharyngeal space, and this is the retropharyngeal space. The retropharyngeal space is extend from the base of the skull to the bifurcation of the trachea. It's located between the alar fossa and buccopharyngeal fossa, covering the muscles. And source of infection can cause the infection of parapharyngeal space, parotid, esophagus, and retropharyngeal nodes, spine. And applied anatomy is there is a collection of the abscess in the retropharyngeal space, forming retropharyngeal abscess. Now the pharynx divided into the 3 parts, like nasopharynx, oropharynx, hypopharynx. The upper one is the nasopharynx or epipharynx, which lies behind the nose. This is the nasopharynx. And in nasopharynx, the structures present are the fossa of the Rosenmuller, which is the common primary site for the CA nasopharynx. Other are the nasopharyngeal tonsil, also known as adenoids, nasopharyngeal bursa, Rathke's pouch, tubal tonsil, sinus of Morgagni, Passavance ridge, and epithelial lining. Functions of the nasopharynx is the warm and humidification of the air to maintain the pressure equilibrium. It helps in the elevation of the soft palate, and it acts as a resonating chamber during the voice production and is a draining channel also. See, this is seen from the behind. These are the three turbinates, posterior end of the turbinates, and this is the nasopharynx. This is the oropharynx, and this is the hypopharynx. Seen from the lateral, this is the nasopharynx, this is the oropharynx, and this is the hypopharynx or laryngopharynx. Nasopharynx, as already said, lies behind the nasal cavity, extend from the skull superiorly, base of the skull superior to the soft palate inferiorly. It communicates inferiorly with the oropharynx through the velopharyngeal sphincter, which is made by the posterior part of the palate. And nasopharyngeal tonsil lies in the roof adenoid. And in the lateral wall, there is a pharyngeal opening of the Eustachian tube. Oropharynx, it lies behind the oral cavity in front of the second and third cervical vertebra. It extends from the soft palate superiorly to the tip of the epiglottis. Anteriorly, it communicates with the oral cavity, superiorly with nasopharynx, inferiorly with hypopharynx. And patent tonsil lies laterally between the anterior and the posterior pillars. You can see that is the posterior pillar, which is formed by the paratopharyngeal muscles, and this is the anterior pillar, which is formed by the paratoglossal muscles. So the tonsil lies in between these two pillars. Function is the passage for the food and air, helps in deglutition, speech, it helps in the appreciation of the taste, and it also helps in the local defense and in immunity. Tonsils, they are large in children and regress after the puberty. If there is infection of the tonsil, there is a chance of the tonsillitis and also the formation of the abscess in the peritonsillar space known as peritonsillar abscess. And if the patient has a recurrent infection of the tonsil, then we can go for the tonsillectomy. Sometimes there may be the referred pain to the ear also from the tonsillitis. Or if there is an irritation in the glossopharyngeal nerve, then it can lead to the eagle syndrome. And other is the septic focus, which causes septicemia also. And the third one is the hypopharynx. It lies in front of the third to the sixth cervical vertebra. It extends from the tip of the epiglottis superiorly to the lower border of the cricoid cartilage inferiorly. It communicates anteriorly with the larynx, superiorly with the oropharynx, and inferiorly with the esophagus. The hypopharynx does not only lie behind the larynx, but also it projects laterally on each side of the larynx like this. So it is formed of postcricoid region, which is behind the larynx, two piriform fossa or sinus on each side of the larynx. And the posterior pharyngeal wall. These are the three subsides of the hypopharynx. One is postcricoid region, piriform fossa, and posterior pharyngeal wall. This is the anatomical picture. These are the three subdivisions, three subsites of the hypopharynx: piriform sinus or piriform fossa, posterior region, and posterior pharyngeal wall. This piriform sinus is useful while giving anesthesia of subglottic part of the larynx and referred pain to air in case of the CA of the piriform fossa or sinus. Postcricoid region is mainly common site for the carcinoma. In case of the anemia, there is a syndrome called anemia, C of the postcricoid region and laryngeal way. There's a Patterson-Kelly-Brown syndrome, and posterior pharyngeal wall, it extends from the hyoid bone to the cricoarytenoid joint. This is the posterior view of the pharynx. Functions: this helps in speech and deglutition and is pathway for the air and the food. Blood supply. The blood supply of the tonsil is from the external carotid artery and its branches. One is tonsillar artery, is a branch of facial artery, ascending palatine artery from facial artery, ascending pharyngeal artery from the external carotid artery, and descending palatine artery from the maxillary artery, and dorsalis lingual artery from the lingual artery. And lymph node drainage. The nasopharynx drains into the retropharyngeal lymph node, which later on drains into the upper digastric cervical lymph node. Oropharynx and hypopharynx both drain into the upper digastric cervical lymph node. Nerve supply, mainly the 10th nerve is motor, except stylopharyngeus, which is supplied by the glossopharyngeal nerve, and tensor palatal muscles is supplied by the 5th nerve or trigeminal nerve. Sensory, nasopharynx is supplied by the trigeminal nerve, oropharynx by the glossopharyngeal nerve, and laryngopharynx by the vagus nerve. Autonomic innervation is sympathetic from the sympathetic ganglion and parasympathetic to the 7th facial nerve. Thank you. That's all the anatomy of the pharynx. Is there any question? Just remember this supply of the tonsil, this artery is very important, this slide. And other is the, just remember the anatomy, where it lies. See, this is the nasopharynx, oropharynx, and hypopharynx. Mainly important is this picture. You just remember this picture, then just remember this picture, then you can know the anatomy of the pharynx. See, this is the nasopharynx behind the nose, oropharynx behind the oral cavity, hypopharynx or laryngopharynx just behind the larynx. And the hypopharynx has a lateral structure. This is the piriform sinus, this is the postcricoid region, and the posterior pharyngeal wall is caught in this section. There are 3 subsites. Just remember these 3 subsites. And this lateral side, there is a space, parapharyngeal space, and in the posterior to this area is a retropharyngeal space. These are the important structures because there is a chance of forming abscesses in retropharyngeal space and parapharyngeal space. Thank you. Is there any question?